Welcome to your latest update on the COVIDENCE UK study. My name's Adrian Martineau and I'm the lead investigator based here at Queen Mary, University of London. So those of you who've been following these webinars regularly will remember that some months ago I covered some really interesting data from colleagues Aziz Sheikh and Gwyn Davis, showing the impact of lockdown on asthma attacks and deaths. Let me just remind you of those data. So here in the blue triangles, this shows the 5-year average before the pandemic in terms of trends for admissions to hospital for asthma attacks in Scotland on the left here and in Wales on the right. And then in red, you see the pattern that was observed over the first lockdown in spring 2020, when there was a sharp decline in hospital admissions due to asthma attacks, both for Scotland and for Wales, that coincided with the imposition of lockdown restrictions. So the hypothesis here is that once restrictions were imposed, this resulted in increased use of face coverings, reduced social mixing, which then reduced transmission of respiratory viruses. Respiratory viruses are known to be major triggers of acute respiratory infections, of course, which in turn trigger asthma attacks. So today I want to follow up on these data and ask the question, well, what happened once restrictions were relaxed? And we're in a good place to answer this question with data from COVIDENCE UK, and we can actually look at two key components of the response to relaxation of restrictions. First of all, looking at how people's behaviours changed, and then secondly, looking at whether this change in behaviour was associated with a change in risk of acute respiratory illnesses, including COVID-19, non-COVID acute respiratory infections like the common cold, and also asthma attacks. So let's focus first of all on how behaviours changed following relaxation of lockdown regulations. First of all, we'll look at use of face coverings in the COVIDENCE UK cohort. So let me orientate you here on this graph. On the y-axis, that's the vertical axis here, we have the proportion of people who say they used a face covering 100% of the time when they're in an indoor public place. And here on the y-axis, on the x-axis, sorry, the horizontal axis is the month and year, so that represents the passage of time. And just to orientate you, we're starting in November 2020. This period here over late December and of 2020 and spring of 2021 coincided with the second lockdown. And then this second period here on the right that I would just want to highlight illustrates the timing of the emergence of the Omicron variant of SARS-CoV-2, which started to circulate in the UK towards the end of November 2021 and became the dominant variant in the middle of December 2021. What you can see here is that the imposition of lockdown 2 associated with very, very high rates of face covering use. As restrictions were relaxed from the end of spring 2021 through to autumn 2021, we saw a reduction in face covering use. And then as concerns emerged around the emergence of the Omicron variant, face covering use increased again and then decreased again following the release of all restrictions in spring of 2022, as concerns around Omicron tended to fade in the general population. What about visits to shops? Well, what you might expect is a reciprocal relationship or inverse relationship. So when face mask use is high, visits to shops are low. And indeed, that's what we see. So here again, you can see lockdown 2 from the end of 2020 through spring of 21, associating with a dip in visits to shops. And actually, the emergence of the Omicron variant didn't really affect the frequency with which people visited shops. Visits to other indoor public places, things like pubs, cafes, churches, libraries, etc. Again, you see the same sort of pattern as with shops, so a dip here in winter 20, spring 21, and recovering back to normal levels as lockdown restrictions were relaxed. Similarly, with visits to and from other households, a strong dip around the time of lockdown 2, which then went up as restrictions were relaxed. And the same pattern again is seen with public transport use. So a dip around lockdown 2. Interestingly, also a dip here with the emergence of the Omicron variant in December 21, January, February 2022. And the same pattern is seen with international travel. So a strong dip here around lockdown 2, and then a second dip around Omicron. So we're seeing an overall pattern here, two sets of pattern, in fact, with face covering use being high during lockdown and travel, social mixing being low during lockdown, and then this recovering over the period of relaxation, and then a second bump or a second dip coinciding with the emergence of the Omicron variant. Okay, so we've looked at what happens when restrictions were relaxed to behaviours. What about acute respiratory illnesses? Well, first of all, of course, let's look at test confirmed COVID-19. So this is SARS-CoV-2 infection confirmed with a swab test, either with antigen testing and or by RT-PCR. What you can see here is that rates were really pretty low around following imposition of lockdown 2, and as that was released, they started to climb from June 2021, and then with the emergence of Omicron, which of course is much more infectious than the previous variants of SARS-CoV-2, we saw quite a precipitous increase in SARS-CoV-2 notifications to COVIDENCE UK. What about non-COVID acute respiratory infections? And by this, we define them according to the symptoms that people report, so upper respiratory symptoms, lower respiratory symptoms, and symptoms of influenza-like illness. But we're classifying them as non-COVID acute respiratory infection because whenever people experience these symptoms, we're just looking at times when they swab tested and they swab tested negative for SARS-CoV-2. So we can be reasonably confident that these infections aren't caused by SARS-CoV-2. And what we saw here was a dip in these infections over lockdown 1, and then as the restrictions of lockdown 2, as restrictions of lockdown 2 were lifted, so we saw an increase, a rebound in non-COVID acute respiratory infections, with a small dip here early in 2022, possibly reflecting increased use of face coverings and decreased social mixing associated with concerns around the emergence of Omicron. As for asthma attacks, here we saw again a decline over lockdown 2, and as restrictions were relaxed, we saw a rebound increase in asthma attacks, with flattening off over the time of increased caution associated with concerns about the emergence of Omicron. So now we have an alternative hypothesis to the one that I presented at the beginning, relating to the effect of imposition of lockdown restrictions. Here we now have a hypothesis looking at the effects of relaxing those restrictions. So it may be that as we relax those restrictions, we're seeing reduced face covering use, increased social mixing. That associates with increased transmission of respiratory viruses, not just SARS-CoV-2, but rhinovirus, influenza virus, and other viruses which are common causes of acute respiratory infections. And these, of course, then are major triggers of asthma attacks in people who have underlying asthma. Of course, there are alternative explanations for the trends that I've reported in the talk today. One possibility, of course, is that as restrictions were relaxed, so people started to use motorised transport a lot more, air pollution went up, and that might be responsible for the increased asthma attacks, or at least contribute to the increase that we saw. Similarly, as restrictions are relaxed, people with asthma might be less concerned about the potential impact of COVID-19 on control of disease, and they might just perhaps be a bit more forgetful than previously in terms of using prevention inhalers, and that might then also lead to a rebound in asthma attacks. So what's the bottom line here? Well, first of all, I think what is really clear is that COVIDENCE UK participants really did follow the rules in terms of the recommendations regarding use of face coverings in public places and reduce social mixing during lockdown 2. And I think that when you look at it in the broader picture of the population, really explains why the lockdowns were successful. And there's no doubt that in particular lockdown 1 saved numerous lives, and lockdown 2 will also have relieved a huge amount of potential pressure on the NHS. And we've shown that in previous presentations, that there's a strong correlation between the number of household visits and risk of COVID-19 and other respiratory infections. I think the second point to highlight is that others have shown that imposition of restrictions was followed by a dip in asthma attacks and indeed in non-COVID acute respiratory infections. And although this was assumed to associate with altered behaviours, it wasn't formally shown. Apologies for the typo there. Now we show that release of restrictions is associated not just with the return of behaviours towards normal, but also with a rebound both in COVID-19, also in non-COVID acute respiratory infections, and also in asthma attacks. Well, you might say, so what? It's not exactly unexpected that as restrictions are tightened, so social mixing reduces and transmission of respiratory viruses goes down, and the opposite might well be expected to be the case. But actually, I think these results are pretty significant. And the reason is this, because if we can identify the particular ingredient of lockdown measures that mediates improvements in respiratory health, what we can then do is potentially recommend this particular ingredient of lockdown to vulnerable groups during wintertime to reduce their risk of getting infections and reduce their risk of getting asthma attacks if they suffer from asthma. In other words, what we want to do is try to dissect out the different components of the lockdown experience, identify which of those are responsible for the favourable effects we see, and kind of bottle them so that we can then recommend those particularly to people who are at highest risk of adverse outcomes. And that's what our team of statisticians are working on now, and I'll keep you updated on our progress as we work using all the rich data that you've shared with us and continue to share with us. So that brings this presentation to an end. I just want to thank all of you for continuing to contribute data every month. We continue to analyse it, and it continues to provide insights which will hopefully result in improved public health in the short to medium term. I also particularly want to highlight the contributions to the current analysis from Florence Tideman, our statistician working on this question, and Dr. Paul Pfeffer, who's a respiratory consultant at Barts Health NHS Trust, who was really critical in providing advice and ideas that contributed to this talk. So thank you all, and I look forward to seeing you next month. Goodbye.